I'm going to ask one question and then I'll go on to all the questions that we got on from the audience on Slido. The question is, what are the things that are often overlooked and possibly undervalued when designing a service that now have more importance than ever? So something that before you might not have paid attention to, but that now is actually really, really important.
So just to repeat the question, so people...
So something that before, I guess, like now after having the experience or having go through like, you know, designing a service within an emergency context, what are the things that now have a lot of importance that in a normal, let's say, context you wouldn't have paid attention to, or that are often overlooked, if any? Maybe there are none.
I guess the thing we were chatting about before, I think this... that the internet is like central to how you deliver services. Like I think before people would just see it as like channel shift, but actually now it's just like instrumental to it. So for example, while the big part of our service is, yes, the sort of telephony assistant people call up, we've been doing a huge amount of work on our case management system and how we actually record information and like send it out to other organizations or our regional teams. So I think the recognition that we haven't got all of our infrastructure in place yet to be able to respond to emergencies in the way we would like to, and how information gets shared. But equally, we've been talking about those problems have been around for a really long time, and they haven't. Hopefully this brings it to more sharp relief, but I don't know.
Thank you.
From my perspective, Maria, it's been an issue that we come across occasionally is what we call alert fatigue. So it's related to people who are constantly warned. So either because they are constantly in danger or because we give them false alarms. So there's an element, there's a risk of issuing false alarms with any warning system because of the nature of risk. But I think the way that slowly authorities are moving to address that is more sophisticated approach to risk, which is based on an international standards that's called the Common Alerting Protocol. So rather than having quite fixed views of what constitutes risk, they break it down by risk of severity, risk of urgency, a risk of certainty. So I feel that breaking down risk for us in that way means we can give more tailored content to people. So that's helped us.
Cool, thank you. Elaine, do you want to add anything, or I can jump onto the questions from Slido?
I think just one thing that's coming to mind for me is the importance of knowing how to make decisions. So, and that's something that we're kind of grappling with at the moment. Lots of the wider team across Brent come from a community advocacy background where lots of things are done by consensus, and that feels like it is at the heart of what mutual aid is about, because it enables us to have a democratic structure that really does represent the community. But as you probably all know, consensus isn't necessarily the easiest way to make decisions, and it can cause decisions to draw out. And so I wouldn't say I have an answer there, but that's something we're grappling with, is kind of how do you maintain transparency, but also make sure that we're not missing opportunities to help in the meantime.
Cool, thank you. So one question here is, what's your relationship to your local authority or council? What could they learn from mutual aid groups, and where could council support be of benefit?
Yeah, thanks for asking that. So we have, I would say that the relationship with the council actually varies quite broadly across the different mutual aid groups, across the different wards. So in fact, for some mutual aid groups, they were set up by the local councillor. I think in Alperton, that's the case, and a couple of others as well. Others have a much warier orientation towards the council. And so that has been an interesting conversation between those two ends of the spectrum. In general, the council realise that we are plugging gaps and are aware of pockets of vulnerability that they're not necessarily aware of. And so they definitely have offered us support in different ways, particularly when it comes to safeguarding and longer term cases where we're very aware that we can't necessarily take those on. In terms of what they could learn from us, I think one thing that we would actually love to see is we sort of feel like the council can be a black box in some ways, where, you know, obviously everyone in the council is working flat out at the moment to help people through this crisis, as we all are. But we would love to have a bit more access to some of their processes and understand a bit more about what's going on, in order to help us work more smoothly together. But yeah, in general, it's been a super positive relationship, and especially when it comes to things like helping us connect with food aid and those sorts of things which we couldn't manage by ourselves. It's been fantastic.
Mm-hmm. Cool.
Can I just add something to that as well?
Sure.
I think it's really great seeing how small informal groups are like self-organising around this. So for people who may or may not be aware, when the Grenfell disaster happened, actually a lot of the response was through local community groups. So rather than going to like the council space, lots of people went to the local church, the local mosque, the local youth club, and they were able to like be a lot more agile, I think, in how they did it, and they didn't necessarily have to worry so much about other organisations as stakeholders. So I think there was some really interesting things to be learnt from that as well, and also just be able to just be very adaptive, where larger organisations have to think about risk, or there's much more questions around risk before doing anything. So I think there's loads that could be learnt from smaller organisations, from like more formal organisations like councils and even Red Cross.
Yeah, definitely. And I think there's a balance there between, you know, we tried to put our own safeguarding safeguarding measures in place without introducing some of the red tape that exists around larger organisations. And we've had to find the balance between, you know, what's the right level of those measures to introduce without, again, holding us up.
And I think what would be really interesting in the future is about when smaller local organisations are responding, how can larger ones actually help with the support structures to help you lot do the job? A bit like what we were saying about volunteers being the service. What do you do to put things around them? So with Grenfell, I know there was a lot of volunteer burnout because a lot of people felt like they just had the sort of, they weren't expecting it to last as long as it did, the sort of response. So I think that's definitely an opportunity, I think, to support in that way rather than sort of like compete or whatever.
Mm-hmm. Absolutely. Cool. There's another question here that says, what do you think are the key similarities and differences between environmental and public health crises in terms of types of service, comms, user needs, etc.?
I would probably say there's a lot of similarities between environment and public health emergencies. I mean, the flood warning service up until recently, now that it's been proposed, basically, they've purposely dropped the flood, so the F from it, and it's now the next warning system. And it's because it's been built as a central message sending engine, and as part of that, there's a cross-department move to cooperate with, we've talked to Public Health England, we've talked to Animal and Plant Health Agency, we've talked to quite a few partners actually, because the crisis cycle is very similar, whether it's flooding, whether it's fire is a little bit different, but certainly animal outbreaks is quite similar, and infectious disease, in fact, has been similar, and there has been some partnership between the Environment Agency and the NHS as well on that. So I would probably say it's obviously the consequence and the risk is the actual hazard is different, but the way that we tackle it isn't necessarily that different at all.
Mm-hmm. Harry, do you want to add something there? Because you were saying earlier that you can be prepared for emergencies And I guess there are like lots of learnings that can be extrapolated, as Silvia was saying. I don't know if I've seen you've been asking for lots of references. I wonder if you've built on different examples of emergencies or types of emergencies.
Yeah, like last year we ran a big discovery into fires and floods because they're the two types of emergencies the Red Cross responds most to. And as Silvia was saying, like floods are increasing. In terms of similarities of needs, I think there is certainly quite a lot of overlap, or certainly in terms of approach. So even if you have like a big national emergency, it's actually still a very private event for lots of people. Mm-hmm. And there can be a lot of shame being attached to having to access support in a really vulnerable moment in your life. So one of the things we've been looking at before this pandemic happened is like, how do you proactively contact people who've been affected by emergencies, and how can we like use something like social media to like effectively target people, or use local networks of people to get in contact with them, because we know that lots of people either don't know that support exists, they don't want to have to go to any sort of like public space to access it. And then there's other things around like dignity, and then also like familiarity with people's services. So one of the things we're working on our phone line at the moment is trying to make sure that we have like a very like diverse group of call handlers, for example. So I think there's some real similarities in that. And then in terms of like infrastructure as well, what Silvia's been showing on having messaging, but equally as well having like case management. Like we've been prototyping this something for a while at the Red Cross about having a sort of like registration platform that eventually maybe you can make that open to local councils and to community groups when emergencies happen, because there is no like shared like standard or infrastructure about how we record information about people who've been affected. And that just causes loads of problems. And actually if you just have that stuff built in, and maybe it makes sense for it to be with the Red Cross because we're independent from government and we know not everyone's comfortable with having sensitive information held by the state, that might be one thing. But yeah, I think there's quite a lot of overlap, but not always as well. Like the nature of this emergency is this like face-to-face contact. This isn't the typical interaction, so that changes things a bit. Yeah. But equally, that might be the same with flooding gets really bad. Like you can't get to lots of locations. So, for example, in Cumbria, like that's a very rural area that can be really separated out if a few main roads get flooded. So, yeah.
Mm-hmm. Cool. Silvia, I think this is for you. From your experience with flooding, what are the key learnings or advice for local authorities when designing or managing service during a crisis?
That's a very good question, actually. We spent some time over the last few months, just before lockdown, actually, talking to emergency responding partners from local authorities, so the unit in the local authorities that deals with crisis management. And there is some work for us to do there, basically, because I think the biggest issue we have at the moment is that whereas the Environment Agency is responsible for river, tidal, coastal flooding, the responsibility lies with the local authorities with regards to surface water flooding. So that would be drainage, that would be flash flooding. And obviously the difference is not conspicuous to the user, and it shouldn't be for them. If flood water is flood water, and it's up to us at the back end to actually make sure that they reach the right person. So certainly that, and the way that is being tackled is simply by having better data on a local level, and so that modelling data can then be shared with the Environment Agency, can feed that back in the warning, so that's long term. But in terms of during the emergency, what we do is we give professional partners in the local authorities extra information, like we'll be able to give them heads up as to how many households might be impacted during that specific incident. Even if it's just a model, it will help them get sandbags to the right locations. And something else that came up in our user research with them is boundaries. So I think there's a big problem, generally speaking, with geographical boundaries always matching up. So what central government thinks are specific region lines or county lines are not specific enough on a local authority level. So that is also a point for improvement for us.
Mm-hmm. Another question that is getting a few votes. How do you think services set up specifically for COVID should now evolve as they move on from crisis to longer term support?
Okay, I'll try and answer that. Okay, so obviously we've probably been all following the developments with the NHS X app, and that's happening in a very short space of time. So obviously, well done to the design teams there, because it's intense. My personal view on that is that just like everything we do in design and government is open and is in the open, so it's through open data, so should be the emergency response. So one thing that we're pushing for, and I alluded this in the presentation, is cell broadcast. So that would be a single point of emergency broadcast that could be used by the NHS, it could be used by the police, it could be used by us for floods, and it's basically a system where handsets get targeted straight from the mobile mast, straight to the cell, so we don't need people's numbers, there's no GDPR concerns there. And for me, that would be a much more sustainable way of an alert protocol, rather than having, which is what had to happen during COVID, actually having to leverage the mobile network operators to send out texts, because that can take a long time, is very expensive. So I think we should be considering as a whole, as an emergency response community, the longer term, more sustainable options. And I think cell broadcast is one of these. It's also cheap. It's in a lot of other countries. So hopefully it's something, a direction that government will go into. And with regards to other apps, I think it has to come with a lot of marketing and a lot of communication surge, because as we know, it would have to take a conspicuous amount of people downloading for it to work at its optimal use. So yeah, partnerships.
Mm-hmm. Harry, Elaine, anything you want to add on that one?
To draw, I mean, I guess we're all learning about what this emergency means, but to draw parallels with fires and floods, there's sort of like stages to this as well. And with fires and floods, there is huge effects to people's mental health and finances after they happen. And so I think we really need to look at like what the longer term support's going to be. There is also a sort of like media like attention cliff that tends to happen with any emergency. Obviously this is affecting a much larger number of people for a longer amount of time, but it will drop off. And so I think we have to be really proactive to think about like what and when are things going to like drop off, and who is that support going to drop off at the moment, because at the moment everyone's sort of clamoring to help one another, but it's after that point where that isn't the case. And I'd be very surprised that isn't true for this situation as well. And very often I think that word we've used already is response, and it is quite responsive about some of these things. And historically, both like the state and the charity sector and the market hasn't been very longer term viewed about how you help out with people's longer recovery from an emergency. Mm-hmm. But also as well, like people realizing they can still access help after the fact. So for example, in Cumbria, when they had a huge amount of flooding in 2015, there was the amount of people accessing, so I think maybe 80,000 homes were flooded that time, but the number of people trying to access mental health services was basically the exact same. And the research that looked into what happened, that got commissioned by the council, showed frontline workers, when they were going to visit people in their homes, a lot of them like breaking down, talking about the sort of added stress of having to move house, repair their house, the fear of the flooding happening again. So actually there's a huge amount of unmet need going on, but actually the uptake in the services around that wouldn't indicate that being the case. And so I guess we're going to have to do a lot of work around proactively offering people support rather than trying to do the usual institutional thing of expecting people to come to us.
That's a good point, yeah.
Yeah, I think two things that I would add there. One is something I alluded to at the end of the presentation, which was just about starting to build community spirit. I think it's fair to say that the shape of our, again, service, you want to call it that, currently is not something that we have planned to run for the very long term. Well, obviously it will be there as long as it needs to be in that format. But what we really want is for neighbours to have their other neighbours on their mind more often. I think we'll do that through forming those community bonds. So whether that's eventually social events or, you know, other things that will help introduce people to each other in that really simple way. That's kind of our goal. The other thing that I can imagine us taking forward is what I didn't mention in those 10 minutes was the signposting services that we've built. So, you know, for most of us on this call, it's easy enough to Google if you need financial help to see what the deal is with benefits for self-employed people or whatever it is. But for lots of people we're helping, those things aren't self-evident. And I wonder whether those, and so we've put together these kind of resource packs for people to help signpost them to the correct places. And I can imagine that being something that evolves as the situation evolves over the longer term.
And related to that, actually, there's a very important question here. Are there any ways you're catering for people at risk of digital exclusion when in-person contact is so limited and so much is happening online?
I guess we've gone like phone first. Once again, like talk about fires and floods, we were actually testing some stuff around people to begin with being sent a text message via the sort of technology that Silvia was talking about, cell broadcast, and then they like fill out an online form. And the cell broadcast thing went down well, but they really hated the idea of filling out a form. They felt it felt really impersonal. I think one quote was, "I'd be crying down the end of this." I think that's why we've gone like phone line first. Basically the main need is you just need to talk to someone. So I think that's something we've tried to work on, is trying to work on the easiest channel for people who struggle with the internet to begin with. But, you know, I'm sure it's not perfect.
Can I just add something here as well, which is
Sure.
that we've had to work quite hard for the ways in which I guess our volunteering systems are accessible. So we have this absolutely wonderful 73-year-old who operates picks up the phone line and operates our ticketing system. And for quite a few weeks, kind of both parties thought that she wouldn't make it through the next couple of weeks in terms of, you know, getting to grips with that tech. And eventually I realized that if we couldn't make it inclusive for her, then it wouldn't be, you know, then it's not inclusive for anyone. So she stayed on and she really has got to grips with it. And it's been amazing to see that, just amazing to go through that process of helping understand that and just ensuring that, you know, the opportunity to volunteer is open to everyone.
From our perspective, a bit similar to Harry, it's our main channel shifting channel would be the floodline, so it would be the contact centre. However, that again doesn't cater for everybody who's not online. And I think obviously we do have, if it's a particularly bad flood, there will be local environment agency presence on the ground. There'll be some resilience officers, there'll be people helping, there'll be volunteers, but again that doesn't get us up to 100%. And I think we came across, very interestingly, a group of excluded people that we hadn't really considered before in as much detail, and that's people who don't speak English. So they are online and they have a very, very full life on social media, but they're not confident enough to use a Gov UK service to sign up for flood warnings. And if they were to receive a flood warning, they wouldn't really understand it, and they would need to rely on somebody to translate it. So that's one element. But the other one, and this came up again talking to partners at local authorities, would be traveller communities. And in some counties, they are absolutely massive, especially if you think about counties with farms or fruit picker communities. So they will be there for maybe 2-3 months a year, and they will be sitting on floodplains. So they are the most at risk of flooding. They don't have an address that we can contact them on. They don't have a landline. So in effect, they're almost unfindable and untraceable. And it's almost impossible for them to have them on our system to warn them. And even kids, they might only speak one language. So that is still something we are working on.
Mm-hmm. Okay. So just last couple of questions. What advice would you offer to service designers who are interested in working within public sector, specifically within crisis or disaster management context?
Should I go first? Obviously, attending these sessions is probably the best start, because it brings you right at the heart of the design community conversations. I mean, we don't really have, it doesn't really go that much more in detail as this. So that's certainly one start. And also, I think the design community, especially in crisis management, is very active on different social channels, social media. So definitely try and reach out on those. And also, if you have something to say it. There's a lot of people always willing to hear and listen, and there's a load of channels to do that. And so yeah, just share your thoughts and ideas, and you'll be part of the conversation that way. Yeah.
Nice.
Yeah, I guess I would just say, like, get involved. I think lots of public institutions are catching up with how to respond to, like, lots of people's needs in the internet era, and emergency response is no different. But also, I know probably I can only speak of my own presentation, but it makes it look like it was really straightforward. But actually, a lot of the stuff we've done has actually been a huge amount of winning hearts and minds and actually making space for this work to happen. And so don't think it's just going to be snazzy prototypes, which I wish it was. I wish it was, but it isn't. So there's a huge amount of, like, just winning hearts and minds, and there's a reason this stuff hasn't changed. So I think just come into it with that realism that it's going to do that, but that being tempered with, it's so worth it when you do actually get to make some small changes. And I'm really lucky on my team to have some great people like Ross, who I think is tuning in, who actually shield me a lot from a lot of needed work with stakeholders who, rightly ask hard questions and challenge us on things. So I think 50% of service design is designing services, and the other 50% is winning hearts and minds. So but that's not specific to emergencies, that's across the board.
Mm-hmm. Cool. Okay, I'll just end up with one question for the three of you, which is, like, looking back on the work you've shown us, what is something that you've learned or that you've seen that you cannot unsee now? Something that will stay with you and, like, that you kind of, like, will apply to the rest of your work, I guess, or life, could be personal as well.
That's fine.
I think keeping calm is really, really important. An emergency response, like, I guess in any sort of situation you want people to keep calm and so on, but I think just you do, like, lots of our team's obviously not exposed in the same way as people working in a NHS A&E ward or anything, but I think you have to be able to just keep calm and just not try and rush anything, because you'll just regret it afterwards. I think definitely just slow and low.
I think for me, and this is quite a personal thing, but just seeing the sheer diversity of Brent has been super eye-opening for me. You know, we're in a fairly, actually I wouldn't say it's undiverse, but you know, Kensal Green is a particular part of Brent which probably isn't representative of the borough, and just being able to work with the other wards and see the kind of people that they're serving and helping out and understand just user needs on such a much greater scale than I have done in my previous work has been super eye-opening for me.
Mm-hmm.
For me, related to both Harry and Elaine, it's the personal effect that images have on the people we speak to, particularly through user research. For me, I think one thing that just I keep thinking about actually is, so some of the people that we spoke to who have been impacted in the February flooding, so we've got three storms back to back, and parts of South Wales flooded pretty badly, which is already a quite deprived area of the United Kingdom. To now know that those people still haven't recovered, are living in their upstairs and are now in lockdown. So again, these are the sort of people falling in between the gaps, and it's when you talk to them, you feel all of that. So it's about trying to fight to make sure that they can surface those issues again. And but yeah, it's things that you don't really forget, especially if they have a chat with you, and then it'll they can be quite honest, which is really good. But at the same time, it might be something you're not always trained for. So that would be mine.
Thank you. Okay. So I'll hand over to Martin, but thank you very much for answering all these questions and sharing your knowledge, and also everyone in the audience for posting so many good questions. The ones we didn't get to answer, we'll try to get some answers for you and probably send in that email that Cara will send later. And yeah, thanks for taking the time from whatever you were doing today.